Checking off Brian McCallion.
Hi. First I walk in the room, wash my hands, make sure my hygiene is clean. Hi, my name is Brian McCallion. I'm here as a Liberty nursing student. I'm here to assess you for your vital signs. May I ask you for your date of birth?
4/4/92.
Okay, that's great. Well, we're going to go right ahead and assess you for your temperature. I take the thermometer, take it out of its casing, place it in the sheath. It's important to place it sublingually in the patient's oral cavity. Leave it in there for 3 to 5 minutes. Okay, we're going to go ahead and take your radial pulse. Taking the radial pulse is important, but to assess the patient's respiratory rate, must cross the arm. He will not be informed, or else this may affect other variations in his results. Okay, Mr. Fink, I'm here to discuss your results. You have a strong heart rate of 70 beats a minute. Your respiration is deep and at 14 breaths a minute. And respiration rate at normal range is 12 to 20, while normal heart rhythm is 60 to 100 beats a minute. May I take this out? Okay, we have our result now. It's 98.5, happens to be normal. Normal range is 96.5 to 99.5. Properly disposed, place it back in the sheet case. Also, it's important when assessing the patient's temperature through the axillary region by placing the thermometer in the armpit. He clenches down. Also, it's taken through the rectal opening while the patient's in the Sims position. Next, I'm going to be assessing you for your blood pressure. So we find out his osculatory gap. Take the blood pressure cup, apply it around the patient's arm. Find his radial pulse and feel for when the turbulence faints. Note the number. It's important to note the number when the patient's pulse faints at. Okay. It fainted at 85, so it's important to pump it up to add 30 milliliters of mercury. We're going to let that sit down there for 30 seconds or so. We're going to be taking height and weight soon, so I would ask the patient to momentarily take his shoes and socks off for an accurate measurement. It's about time to assess you for your blood pressure. So, administer the cuff, apply it around again. Okay. Take my stethoscope, place the diaphragm of the stethoscope against the brachial artery. Okay. We're going to pump it up to 135. It's important to note the first two numbers of when the turbulence starts and stops. Well, Mr. Fink, it seems like your results are well good, and his blood pressure seems to be at 110/76. Normal rate is at 120/80. So you're fine. You're a healthy young man, and it's important to assess both of the patient's arm in case if they have cardiovascular disease, because there may be an obstruction in one of the arms, and it's important to take both arms for a more accurate measurement. While taking blood pressure, it's also taken while sitting down, standing up, and lying down. If the patient happens to have a difference measurement of 20 milliliters of mercury, it's very obvious to conclude that he's experiencing orthostatic hypotension. And next, and if the patient has had a mastectomy in one of the arms, it's important to assess the opposite arm for blood pressure. Next, we would assess the patient's height and weight. He would lie up against the wall in a straight posture, heels against the wall, and the most accurate height measurement will be taken. When taking measurement for the weight, the patient beforehand, the scale must be calibrated before the patient steps on. If the patient happens to be on dialysis, it's important to just take the dry weight measurement. And that concludes the assessment. And on the other hand, on the other note, before, when you take this thermometer out, you must shake it to get it recalibrated. And then place it in the sheath, and then place it sublingually in the oral cavity of the patient.